Hello, everybody. This is Dr. Elkhammas. Again, I'm Professor Emeritus with the Transplant Surgery Division at Ohio State University. We will continue our discussion on medical ethics using our reference, which is the World Medical Association Manual. It is really a nice day, so I hope we'll have a good time with this video session. In the previous talk, we covered the introduction. Also, the book covered the definition of medical ethics, and we talked a little bit about the main backbone of medical ethics is really reflection on moral behavior as well as analysis of moral behavior. And we also talked a little bit about medicine is both science as well as art. And we talked about how science is advancing very quick and it has its limits during the medical practice. So you need to supplement that with the art, and that's where the medical ethics and society and family and so on comes in. And today we'll move to Chapter 1. Chapter 1, from page 14 to 33, is really a very nice chapter. It has three objectives stated in the beginning of the chapter. So we'll talk about why ethics is important, and we'll talk what are the major sources of medical ethics, and we'll talk about different approaches to ethical decision making. So these are the three main objectives of Chapter 1 that were set by the authors. It is really a heavy chapter, so I don't think we're going to finish it in one talk, maybe even more than two talks, if we want to discuss it correctly, because it's a very important chapter. It's heavy, and it's really exciting chapter too. So the goal is to stay within 10 to 15 minutes mini talks. And the book in general is usually starts the chapter with a question or two. So one of those questions, what is special about medicine? And if I take you to page 16, you will see that it talks about how in recorded history, as well as almost every culture in the world, being a physician is something special, and people really value the physician highly because they do seek them at time of need. So if they have pain, if they have pregnancy, if they cannot become pregnant, if they have depression, if they have weight loss, weight gain, any really health-related issue, they go to the doctor. And the doctor is given privileges that are not given to any other human being in any other profession. The doctor can ask private questions. The doctor can touch the body of the human being, male or female, and they do all that. Why? Because they trust the doctor. They trust the physician, and they feel they come to that physician to solve their problem and help them. Even though the last several years physicians' practice is different from country to country, and there are places where the government is really intervening a lot, or there are places where the professional managers and bureaucrats are controlling the status of medical practice, and sometimes they may look at physicians as obstacles and not as partners. And it's a continuous process, continuous struggle and fight, and hopefully the goal is to get better. Nowadays, the internet is adding also a different level of challenge, because sometimes you may give your advice to the patient, and if it has been different from what his friend or her friend or his wife or her husband have told her, or what they have heard on TV or they read on the internet, it may become challenging, and they want you to defend your answer. But still, with all that, really the physicians still value their profession, and they love it, and a lot of a lot of students actually go into colleges of medicines, and medical ethics is really quite important to be the core for you and your behavior, whether you are teaching students or dealing with patients. This slide is basically the same summary, just in bigger letters, so I'll leave it for you to read it if you listen to it some other times, or if you are listening to it now. But the main thing is that physicians are being trusted by the human being to help them solving their problems and improve their quality of life, and sometimes actually improve their life expectancy in so many situations. The second question in page 17, what is special about medical ethics? Right away the book states, although compassion, competence, and autonomy are not exclusive to medicine, which is true, physicians are expected to exemplify them to a very high degree. So there is really a heavy load on physicians to have high amounts, or to carry a heavy load of compassion, competence, and autonomy. And the book really look at them as the core of medical ethics in this book. We will not go into some other pillars, but we'll get to them later on. In any case, we'll talk about these one by one for listeners who are not really quite familiar with those terms, and they speak Arabic. Compassion means التعاطف. Competence means الكفاءة أو المهارة. Autonomy means الاستقلالية, أو actually حق الاستقلالية وحق تقرير المصير. And then we'll go a little bit more in each one of them. So when we talk about compassion, what does it really mean in real practice? A patient comes to you with symptoms. Compassion means you are not treating that person as a number, that a human being has feelings. So you try as a physician to understand that person's concerns. That's why they came to you. They felt that they need help. And from where? From a physician. Try to identify the symptoms and make them meaningful to you and to the patient. Appreciate the suffering of that person. And show them sincerely, not faking it. Show them sincerely that you are there to help them solve their problems. That's really the nuts. That's the summary of compassion. And if you don't have it, I don't think you'll be a very successful surgeon. You may have the second character, which we'll get to, but really compassion is very important into having the patient listen to you and respect you and respect your advice, and they follow your instructions. So we're not talking about just for the heck of it. It's really important for the patient's outcome. Okay, how about competence? There's a question mark there in the first bullet. We'll get to it. So competence is very important too, because if you are not competent, how can you really get to the diagnosis and deliver the correct treatment, and if it requires medication, the correct medication, the correct doses, or if you don't know it, how you can seek it, so on. So it is expected that the physician to be really have a high degree of competence. It is expected that if you don't have that, you may create more problems with the patient. It is expected if you don't have competence, you may result in the death of the patient. So what is competence? Competence means your ability to really use what you have read and learned to take care of the patient, to use that in practice. So if you want to do a kidney transplant, for example, as a surgeon to do a kidney transplant, competence means you have the proper training. Competence means you have the ability, you have the talent to do the transplant. Competence means you are up to date to the literature about kidney transplant. You are up to date about the different techniques, and so on. If you are the physician who is taking care of that patient after the transplant, same thing. You want to know the medications, and you want to know how to seek the help of the pharmacist, and to be a team player, and seek the best outcome for your patient. That's really competence. And if we take this principle further, so yes, you know how to do the procedure, but you don't have intensive care unit team can help you, or you don't have the proper ORs, or the proper anesthesia, or the proper nursing care, or the adequate amount of medication, and you still do the transplant, then you are not competent. So competence is really start small around you as your skills, your ability, and so on, into your ability to assess the whole situation and the whole environment and make sure that to the best interest of your patient, that's the right method to treat, and that's the right place to do the surgery, and that's the right doctor to help you, and so on. So competence is extremely, extremely important. And competence sometimes is being missed by governments that they don't have really the right tools to audit competence. Sometimes it's being missed by the administration of the hospital. Either they don't have the tools, or they may not really practicing the administration in the correct way, or is corrupted, or something like that. So competence is really extremely important, and if the physician or the surgeon is not competent, it may result in even bigger problems and death of the patient and bad outcome. And the third component, or the third core, the authors of the book state in the beginning of the chapter, the autonomy. So the autonomy, until the 70s, we were talking about what the physician says, it goes. The patient comes, needs the help of the physician, and the physician knows from medical school and from the reading and the proper training what is the right answer, and he or she tells the patient, and the patient just listen to the instructions. And that is called the paternalistic view, or paternalistic medicine, where you are like, the physician is like a father, and the patient is like the child. So what the father says, the child applies, and so on. And then in the 70s, people realized that's really not necessarily the right approach, and autonomy of the patient is started being recognized, and today the patient is really your partner. So autonomy, it meant the right to autonomy. It meant the right to self-determination for the patient. But we should not forget the autonomy of the physician too. So here we have really two autonomies: autonomy of the patient, which is really important, and respecting the patient as a person, and the autonomy of the physician. So the autonomy of the patient, that the patient need to decide what he wants. If he doesn't want to be treated, it is really his choice. But how about he wants to be treated a certain way that the physician feels, no, I'm not going to offer you this kind of treatment. So there is autonomy of the patient, and of course the correct is to balance both of them together. I added two references down. The lower one is really very interesting article, the Rethinking Autonomy, from a group in Michigan. It says Rethinking Autonomy, Decision Making Between Patient and Surgeon in Advanced Illness. It's a very, very nice article. And the other one is also from AMA, Journal of Ethics. It's a very nice, even though it's older, but it's really very, very good article. It goes through the paternalistic view of medicine and autonomy and physician autonomy and professionalism. So I recommend getting them and reading them, but autonomy is really important for both. So when it comes very complicated, then the patient and the physician and the family need to get together. Sometimes they may even seek help from a professional ethicist to really take care of an advanced situation where there are differences between the patient or the patient's family and the physician and the surgeon. I think we will stop today, and that way we'll stay within the short message, and next week we'll continue with talking about chapter 1. And we're going to go to other questions following this talk. The other question that's going to start next week will be, who decides what is ethical and what's not? And does medical ethics change? And so on. So stay with us and tune in next week. It's really exciting chapter. Have a great week, and thank you so much for watching. I appreciate it.